Good afternoon, and welcome to Congressman Darren Soto's NAACP teleconference. My name is Leah West. I'm the outreach representative for Congressman Soto in our Polk district. Thank you for taking the time to join us today. We hope you find this teleconference informative. We wanted to provide a safe way for you to speak with Congressman Soto in a one-on-one amid this rapidly evolving outbreak. Our goal is to maintain open lines of communication with our constituents and the Congressman. In a moment, I'll turn it over to him, but first, I want to explain the format for today. If you would like to ask a question, feel free to do so by entering it as a comment on your screen. We have members of our team who will be reviewing those comments and sending them over to the Congressman to address during this question and answer session part of our teleconference. If we are unable to answer your question today, please feel free to send your inquiry to our team by emailing to covid19help.fl09@mail.house.gov. Again, that's covid19help.fl09@mail.house.gov. Or feel free to call our district office at 407-452-1171. Again, our district office phone number is 407-451-1171. We are ready to begin. Congressman Soto.
Thank you, Leah, for your great work and wonderful introduction. I want to thank so many of our brothers and sisters in the NAACP for joining us, including many of our pastors and other religious leaders from throughout the district. We want to make sure to have a town hall to directly answer your questions and concerns. We know this is an unprecedented crisis that requires an unprecedented response. When I think of so many families across the district who are in stay-at-home orders with their children, and how many students are learning either through paper packets or if having enough resources, learning over the internet, something that we'll talk a little bit more about today. When I think about so many seniors who are left isolated along with those with pre-existing conditions because they're the most vulnerable to the coronavirus condition, so many young people missing so many milestones in their youth, to all those first responders that are on the front lines, our doctors, our nurses, firefighters, our cops, and others who are putting themselves in harm's way to care for others, our veterans who are facing great loss after having served our country, those who lost their jobs, are wondering how they're going to get their next meal and next paycheck, and so many small businesses across the district, both nonprofit and for-profit, that are wondering how they're going to be able to make ends meet too. We know we have to work together, and so we have continued day to day to have Tele-Town halls with various allies, friends, and constituents across the community to answer these important questions. We will get through this together. I know there are many from the faith community on this phone, those who share in faith like myself as a practicing Catholic, and note that these are the times when we need the most prayers, and certainly we'll appreciate any that we can get to help us on the way to getting back to normal. Unfortunately, the pandemic will determine the timetable, and we see modeling suggesting that the peak in Florida will happen around May 3rd to May 9th. So we know we have a long way to go. We will continue to listen to experts and make critical decisions based upon the facts to help save people's lives during the pandemic. In the meantime, the good news is that help is on the way. Last Friday, we took the dangerous journey up to DC. I got on an airplane with one of my fellow members of Congress, Val Demings, from West Orange County, on a plane with only 5 people to go up and make sure we could meet a quorum call this past Friday to pass the Coronavirus Aid, Relief, and Economic Security Act, known as the CARES Act, that we'll be talking at length here today about. This is a $2.2 trillion coronavirus response and economic relief package. It's the biggest relief and response package that Congress has passed in the history of our nation. And here are a few of the key provisions. First, most Americans will receive $1,200 checks this month. Those making $75,000 or less will receive those checks either through direct deposit, if that's how they get their tax refund, or through a check in the mail. Those folks making between $75,000 and $99,000 a year will receive a smaller check. Those making $100,000 or more will receive a check, since we're focusing our efforts on those Americans who need it most. We should see direct deposits starting as early as April 17th, with checks following in the mail. For our seniors who receive Social Security, there'll be no forms you have to fill out, provided you didn't already have to file your tax returns. Most of our seniors receiving Social Security don't make enough money to have to file a tax return. So there will be no forms they'll have to fill out. And if they get their Social Security through direct deposit, like most seniors, they'll simply just get this payment to their bank account. Veterans, regardless of their past recent employment history, will automatically qualify for this $1,200 check. And there's a new portal that the IRS is putting together that if you don't already get a direct deposit check for your tax return, you can request it. And our office will have more information on that. Families will also receive $500 per child. So the average family of four, where the married couple makes less than $150,000, should receive about $3,400 to help out during the month of April with a lot of these issues going on. And for our immigrant communities, our dreamers, many of them have Social Security numbers, so they'll qualify, but you have to have a Social Security number to be able to qualify for these checks. For those in our immigrant communities who have ITIN numbers, unfortunately, even though we put that into our House bill, the Senate rejected that. So there'll be some in our immigrant communities who unfortunately won't qualify despite our best efforts. There'll also be 6 months forbearance for student loan payments for so many students who need relief, and those with student loans who need relief during this troubling time. We added a robust $600 federal unemployment benefit for up to 4 months. This is on top of the $275 per week for up to 12 weeks in state benefits. And we know that there's been issues with the unemployment website. This is run by the state government. We have been on them consistently for the last couple of weeks, knowing this was going to be an issue. We also just announced a $26 million grant today to the state. We expect the state to get up to $8 billion, which we'll talk about in a moment. But they need to get this website up and running better and hire people immediately to help out with those unemployed. And we'll continue to put the pressure on our state partners. But we want you all to help us by reaching out to your state representatives, your state senators, the governor's office, and other cabinet members so that this unemployment fund could be accessible to all Floridians as soon as possible. We included an expanded definition for the federal unemployment benefits. So those who qualify include employees, independent contractors, and anyone you could think of working in the gig economy, from our hairdressers and out-of-work barbers to those who work for Uber or Lyft or others. So it's a broad definition for the federal unemployment benefit of $600 a week for up to 4 months. Unfortunately, those folks won't qualify for the state benefit. Another thing that we urge you to contact your state representatives, state senators, and governor and other executive branch members because we need that benefit to apply much like the federal benefit. There's also a $500 billion fund for major industries, cities, and states. This will be key for our tourism industry, for our hotels, for our aerospace industry, among other major industries, states, and cities. Unlike during the Great Recession, where we had the American Investment Act and the bailout, where there were abuses with these funds, we've created safeguards to them, an oversight board in the Congress, a inspector general with the Treasury Department, and bans on executive bonuses and shareholder buybacks and excessive dividends. We know we must learn from the mistakes of the past and make sure that this money isn't going to be abused. And each of these loan agreements will have to be made public within 7 days. Another huge program for our communities that you'll hear a lot about is the $367 billion we passed for small businesses. There are two major new programs. There's the $10,000 emergency grant, and that can be rolled into the foundational program we passed, which is the Paycheck Protection Program. And it does just that. It's going to help make sure that millions of Americans, including in Central Florida, remain employed or get rehired. What it does is allows for you to get loans of up to 2.5 times your payroll costs. You could do that through your existing lender. There'll be over 1,800 lenders participating. So most small businesses will go to their regular lender that they work with every day. And those who don't have a lender that participates, which will be very few, they will be able to go to the SBA or SBDCs, including offices right in Lake Wales in Polk County. And this is going to be an expanded definition. So it'll include for-profits and nonprofits, including our churches. Let me repeat that. It will include our churches as well. I know many of our pastors are on the line who may have that question. It also will include our barbershops and hairdresser shops and so many others that I know we've been getting questions over and over about. They will qualify both independently, if it's a solo barber or hairdresser, either for unemployment if they're out of work altogether or have had a significant loss of employment, or they could also seek these paycheck protection loans. And this is the beauty. If you keep 100% of your payroll for the next 2.5 months until June 30th, you will get 100% of this loan forgiven. I want to repeat that because it's so important. If you keep 2.5 months of your payroll at 100% until June 30th, keep Central Floridians employed, you'll get 100% of your loan forgiven. But it's not an all or nothing proposition. For those of you who can't possibly do that, you'll get full credit for the percentage of the payroll you commit to and keep. So if you keep 80%, 70%, 60% of your payroll costs, you'll be able to get that percentage forgiven and you won't have to pay it back. The remainder will be in a 10-year loan with a 6-month to 12-month deferral period with interest up to as high as maximum of 4% with no prepayment penalty. There's no collateral. There's no personal guarantees required for these loans. And of course, if you need to borrow above your 2.5 months of payroll, you can do that through this program as well. You just wouldn't get that part forgiven. But for those of you who have some cash on hand to be able to pay payroll already, you'll be able to leverage this money to pay other expenses like rent or utilities or other expenses and get 100% of it forgiven. But for those of you who will need above that, you'll get it in a low interest loan. So let me repeat that because there's a lot there. Both for-profits and nonprofits, both those who are sole proprietors, LLCs, LLPs, general partnerships, those who are independent contractors with a limitation of up to $100,000 for independent contractors individually. You'll be able to get loans that could be fully forgiven, provided you keep your total payroll. And that payroll cost is an expanded definition. It includes salaries, tips, and commissions. It includes employment benefits, 401k matching funds. It includes sick pay, and it includes family medical leave, healthcare costs and healthcare payments, even taxes that you may have to pay on your employees. It includes everything. So it's a very expanded definition to include all the costs that both nonprofit and for-profit employers may have. In addition, we included $150 billion for state and local stimulus. Florida will get $8 billion from that share. We included $130 billion for our hospitals. I can tell you, particularly in Polk County, Baycare has stepped up to really help with our Central Florida health clinics, which are our federally qualified health clinics in Polk County. Our Osceola healthcare clinics have really stepped up. Our federally qualified health clinics in Osceola County, along with the Orange County Health Department, in providing tests. And we'll go into some of the issues with personal protective equipment and testing and ventilators in a moment. There's also an additional $48.9 billion in food assistance to help out, to make sure no Central Floridian goes hungry, and to help out our farmers, ranchers, and growers. That's the funding that'll make sure that our families who have students in school can continue to have those waivers so that we can have those breakfast and lunch programs. As you already know, any students can go to any schools in any of the counties that they live in and get the food assistance. And this has been the foundation of the programs to help feed Central Floridians, particularly in Polk County. And then, of course, Second Harvest and Feeding Tampa Bay have been part of this, as well as Meals on Wheels and other food banks. We also need funding for our ranchers and our growers and our farmers. More than half the funding, more than half the food for these programs comes from Florida growers, ranchers, and farmers. So we want to make sure they can continue to step up. In addition, we have $30 billion for an education stabilization fund, which 50% will go to K through 12 and 50% will go to higher ed, including Valencia, Polk State, and University of Central Florida. I've gotten to speak at length with Superintendent Byrd and Superintendent Pace of Polk and Osceola counties, respectively. We know that there's a great need for coronavirus response to help out not only our students, but keep them prepared, and then technology, whether it's more devices or more hotspots so our children can have better access to internet. And this money will go to help them with that. And we're working with local providers like Spectrum to increase access to that. We know that's particularly an issue in our rural areas. In addition, we're proud to announce that the CARES Act includes $1.5 billion for historically Black colleges and universities in the form of deferment of repayments and certain loans and forgiveness of others. This is going to be critical for FAMU here in Florida. My ledge director is an alumni of FAMU, Nicole McLaren, who grew up in West Orange County. And that's a program that's near and dear to our hearts. It's also going to help key HBCUs that are on the front lines of the healthcare crisis, like Howard University in DC, which provides the main hospitals for Washington, DC. In addition, we have $10 billion to help out our U.S. military and National Guards who are called in to help with this crisis. Another nearly $20 billion to help out with our VA hospitals for so many veterans who are going to go in for care due to the coronavirus pandemic or other issues, not only at the Orlando VA hospital in Florida's 9th Congressional District, but over in Tampa and the many clinics. And lastly, there's going to be $48.5 billion that we passed to help out transportation and housing needs. This is going to keep Citrus Connection and Links going strong, Sunrail, and our Orlando International Airport among emergency housing needs that we desperately need during this crisis. We got some local grants that came in already as part of our $8 billion local share for Florida and beyond. And we saw Polk County receive over $3.2 million 2 days ago, among help with $936,000 for Osceola County and over $6 million for Orange County announced just yesterday. We're working with some of the smaller cities who haven't gotten community development block grants through the USDA funds for small rural development and also through CDBG funds, and we're continually in contact with our city commissioners on that. There's some individual letters that we help lead the charge on that are yielding huge assistance for our community. I led a bipartisan letter to stop foreclosures and evictions throughout the state of Florida. And we're proud to say that the Supreme Court and now the governor has stepped up to approve this ban. which includes a ban on any foreclosures or evictions for the next 45 days. And we hope to expand that as provided and needed during the crisis, so that no one during these stay-home orders can be kicked out of their houses or apartments because they can't pay the rent, because they can't pay the mortgage. We also led a bipartisan letter to stop utility shutoffs, and all of our major utility companies have agreed to this during the national pandemic. Lastly, I want to go into the roadmap, because a lot of you may wonder, how far and how long is this going to be? And while a lot of this will be judged by the pandemic, we want to get a frame of mind of how this will work. And so we have a helpful roadmap for the coronavirus of 4 phases to set triggers for states and other local governments to be able to know where we're at in this process. And of course, it'll be different for different communities. First, there's phase 1, which we're currently in, which is the rise of the pandemic for our community here in Florida. As COVID-19 cases rise, unfortunately, till about probably May 9th, we need to expand our critical care beds and increase testing to 750,000 people per week in our state. Next is phase 2, which is where we see a reduction, which we can see in early to mid-May. To get to phase 2, we need to have sustained reductions of at least 14 days straight. That's the incubation period for the coronavirus. And that would mean we could gradually start lifting social distancing measures and start opening our schools and businesses while increasing surveillance on those who have it. Key goals thereafter would be to accelerate the development of new treatments, deploying tests to determine who has recovered from infections, even determining who of our healthcare workers have some immunity to return to the workforce. Phase 3 will be improved treatment as we develop a national vaccine and better treatments for the COVID-19 virus and launch mass vaccinations. And phase 4 is long-term recovery to rebuild our nation's capacity to deal with the pandemic and build up our scientific and public health infrastructure. And we know we desperately need to do that. Finally, I'm going to talk about the long-term recovery package, what we call the phase 4 bill that we expect we could pass as early as late April to early May. And it has 3 key pieces to it. First, investments like we know we need to help increase our preparedness for pandemics in the future, increasing hospital capacity, increasing the amount of doctors and nurses, increasing the national stockpile of personal protective equipment, of testing and ventilators. Second, potentially another round of individual relief, like those stimulus checks we talked about, like that unemployment benefit that goes for 4 months right now, and the 2.5 months of relief for small businesses, including nonprofits and for-profits, and potentially more help to our hospitals and small and large businesses, state and local governments as necessary. So we'll gauge whether we need another round of relief. Lastly, we have a positive opportunity here with the potential of a long-term infrastructure package in this phase 4 bill to foster lasting economic recovery, increase jobs, and potentially foster a major rebuild of America's hospitals, roads and bridges, airports, ports, rail, transit, energy grid, and broadband. This presents us with the potential opportunity to get the Beyond I-4 Ultimate highway funding much earlier than anticipated. This would include expanding 4 new lanes from 434 in South Orange County all the way through Highway 27. There are folks in Osceola and Polk County who have to drive an hour to an hour and a half into Orlando in about that same time period into Tampa. So this could give us a huge help to fix the traffic, as well as speed up the potential for Sunrail going into Polk County and to help out with Brightline going through to Tampa. So it does present a long-term opportunity during this terrible crisis to potentially get infrastructure needs done much earlier than usual. With that, we have slated another 45 minutes or so just to cover your questions. I know that was a lot of information, but I wanted to present you all with a complete as possible presentation of all these issues and all the relief that we've passed, because I know people are scared and they need our help, and we want to make sure to get you all the information. Of course, we'll provide you with those summaries after this teleconference as well, so that you can let your parishioners, your fellow business owners, and members of the NAACP know about all these programs and a lot of the issues going on. With that, Leah, let's begin the question portion of this Tele-Town Hall. And please, everybody, feel free to ask questions and comments. We have plenty of time for it.
Thank you, Congressman. We'll open this, we'll start with the general questions, and we're going to now start with the general questions. If you would like to ask a question, please do so by entering it as a comment on your screen. For those of you who are calling in telephonically, you can press *6 to unmute yourself. Question?
Hi, good afternoon.
Good afternoon.
Good afternoon. This is Dr. Regina Agard. I
lost you for a second.
Can you hear me?
Yes, I can hear you.
Okay, great. Okay, I just want to say thank you, first of all, for taking the time to host this for us and give us some information that we really needed. It was critical. Will there be any information that we can download? So, because it was a lot to take in, and I wasn't on the screen, so I don't know if you had it on the screen, but is there anything we can also have emailed to us so we can get this information disseminated to the community?
Yes, of course. We have one-pagers on each of these different areas that Leah will be providing to all of our participants. And we're also going to give you my overall summary that really just goes into top line items. But yes, we'll have one-pagers for several different areas that I discussed for all of you to be able to review and turn to as you need to ask questions and answer questions throughout our community. We'll continue to have constituent town halls, small business town halls, ag town halls, first responder town halls, and other town halls that your fellow NAACP members and parishioners and others can participate in. We certainly encourage you to be on those teams. We'll get you those summaries, absolutely.
Great.
Thank you for your question.
So, my question, can you? My question is the testing issues. We have a lot of people concerned about not being able to test, not having test locations for testing, feeling symptoms but not meeting the criteria for, okay, you don't have a fever, you weren't identified, and we know that this virus is asymptomatic. So what are we doing about that criteria, and also beefing up and ramping up the testing criteria? We need more testing. There are people who are not able to test, including myself, including fellow community members, and they're concerned, and we have nowhere to go, or we don't meet the criteria to be tested.
So first of all, I'm deeply disappointed by the slow response by the federal government in getting the personal protection equipment, the testing, and the ventilators out in a major way. And so we passed $130 billion to our hospitals and CDCs and others to be able to have all the money they need to ramp up. We should see over the next 2 to 3 weeks improvement, but I do want to take a few minutes to understand, so that everyone understands how this happened. There were intelligence briefings as early as January or February that suggested that what was happening in China with their pandemic was going to happen here. And unfortunately, they were ignored. And we had to go it alone in the House, with the House Democrats leading the way in March 6th by passing the first of now 3 bills to fund both the state, federal, and local governments with billions of dollars. And we approved telehealth for a lot of seniors in that bill. We almost had folks saying that we didn't even need it and that this was a hoax. But then finally the president and the Senate came along, and then we passed our second and third bill. So that was a slowdown. In addition, we had a World Health Organization test for COVID-19 as early as February, but the president rejected it under his America First policy and tasked the CDC with developing our own American-made test. the CDC's first round of tests were contaminated, causing us to be behind 2 to 3 weeks in getting tests out there, unfortunately. And then on top of that, we didn't get a national declaration of emergency declared till mid-March. And we still don't have the full use of the Defense Production Act, which allows the president to be able to force industries, like we did in World War II, like we did after Hurricane Maria and Hurricane Irma and others, to all tackle this production problem. There have been some industries that he's asked under the act, like GM, Ford, and Tesla to join, but we really need this to be an industry-wide thing, and I've signed on to bipartisan bills in the House to push them to do that. Right now, most of the new supplies coming in, the next 22 shipments will be from Europe and China. And while Europe is our allies, and while China certainly is not our enemy, although they don't share all of our values, obviously, this is a precarious position to be in. But I expect over the next 2 to 3 weeks, we'll have a major increase. I know we just got in enough for 130,000 tests statewide yesterday in Florida, but we need to continue to ramp up. And a lot of the national supply is going to New York, to Washington, to New Jersey, and some other areas that are further along than we are. But it troubles me. So what we're doing on the day-to-day, we have every hospital, every federally qualified health clinic, every clinic in general getting us their specific personal protection equipment, ventilator, and testing needs. And since I sit on Energy and Commerce and we have jurisdiction over Health and Human Services and CDC, we give them those numbers every day for each individual hospital, each individual clinic, and we also give that to the Florida Department of Emergency Management. I'm in the Congress, so I have oversight, and we put in enough money to get this thing done. We pass laws, but the day-to-day government is run by the governor and the president. So all we can do is get this information to our decision makers on the executive branch every day, and we're slowly seeing more testing, more equipment coming in, but it has been frustrating. And what I commit to you is every day we will submit those. Every day we'll make those phone calls, and we continue to meet with our first responders and hospital professionals every week, along with our elected officials, to continue to field those needs and push as best we can. But it's been frustrating to say the least, and I'm very concerned about us ramping up as we get to the peak around May 9th. So we'll continue to do everything we can, but there's been definitely issues nationally that have set this nation behind, and now we just got to work together to try to fix those.
Thank you.
Thank you for what you do to help our constituents. We'll take the next question.
Good afternoon, Congressman. This is Dr. Arla Wayne Johnson, and I'm the president of the Osceola Democratic Veterans Caucus. How you doing today?
I'm doing well. Thank you for your service, and we obviously remember our veterans in all of this.
Thank you for recognizing us, sir, and I thank you for your focus on veterans. You're probably one of the only politicians here in the state that I've heard having the veterans issue at hand. I have in 2010, I did a dissertation, PhD dissertation on how Homeland Security can protect U.S. critical infrastructure from cyber terrorism. I sent you a copy of that. On page 172 of the dissertation, it lists a template and or a model that we should follow as a nation to identify those issues that we're having right now. It lists a concept of operation. It lists the logistics that we should deploy. It lists risk and identification of elements that surrounded the issues. And it also lists lessons learned. I think that this is something that we need to visit. My question to you is, and if you need another copy of it, I'll send you another copy of it. But it's under, again, how Homeland Security can better protect U.S. critical infrastructure from cyber terrorism. And it deals with cyber terrorism. It deals with natural disasters such as the hurricane, preparing for the hurricanes and also bouncing back from the hurricanes, and also mitigating the risk, and certainly it deals with this pandemic. My question to you is, you mentioned the CARE Act, and my question, are we rewriting the eligibility of the federal benefit under the CARE Act to apply to those other than laid off Floridians, such as individuals that have lost their businesses?
The answer is yes. I didn't go too into it yet, but these are some unprecedented wins during this terrible crisis of benefits and expanded eligibility that hasn't happened before in the history of our nation. First, let's talk about businesses directly, which was your question. So we have the Paycheck Protection Program, which applies to a whole myriad of businesses, from small businesses of 500 or less who are for-profit corporations, nonprofit corporations, including our churches and most charitable organizations, other than chambers of commerce aren't included, who are C6s, which was unfortunate. But it also includes LLCs, LLPs, general partnerships, limited partnerships. It includes sole proprietors, and independent contractors, and anybody you could think of in the gig economy. They have the option, if they've totally lost all their work, because some of these independent contractors and gig businesses, there's no work to be had. Then they have the option to go and get unemployment benefits of $600 a week for up to 4 months. If they have some business still available, but they have a huge loss in business, they could apply for the Payroll Protection Act. And that can pay up to 2.5 months of payroll, even if you're one employee, just yourself. For a single sole proprietor or independent contractor, the max is an annual salary of $100,000. So you'd be able to get 2.5 months, up to 2.5 months of that type of salary. So in that case, it'd be $25,000 if you have payroll records, of course, to back up the fact that that's what you're making already. And of course, lesser amounts than that for those depending on your payroll. For the unemployment benefit, that $600 is for a week for up to 4 months. You'd go through the state unemployment insurance website, much like and that's in addition to the state benefit of $275 a week for up to 12 weeks. But the state benefit doesn't cover independent contractors. It doesn't cover anybody in the gig economy, and it's much shorter and much less generous. So when you're asking about new benefits, if you're not a W-2 employee who lost your job, you now have this new federal benefit, but you still aren't eligible for the state benefit. And you could talk to your state representatives, state senators about it. And I would be remiss if I didn't mention again that this state website is a disaster right now. Yeah. And we just gave them a $26 million grant today to help them get their act together. But in addition to expanding those unemployment benefits, talk to your state representatives and talk to your state senators about the website as well. Those are things where we're giving them the money, but they got to get their acts together on this. So yes, we have a new federal benefit for unemployment that's more generous and applies to all these non-employees who are independent contractors in the gig economy. And then yes, they also can qualify for the small business paycheck protection program if they'd like to, in the alternative, should they have some business, but they have a huge loss of business. So you could go either way on that. And those are big expansions. One other expansion of benefits I do want to talk about, since we're on the subject, this is the first time in the history of our federal government that we have now paid family leave and paid sick pay in our federal statutes. That was under the Phase 2 bill that we passed, the Families First Act. The CARES Act is Phase 3. It's only for the coronavirus, but it's the first time in history we've had it. We recently were able to pass it for federal employees, but we've never had it for the general public. It applies to businesses 500 and less. 90% of businesses 500 or more employees already have it, so there is that gap we have to fix. But we were able to get some things passed that we never had done before. So thank you for those great questions and appreciate your service.
Thank you very much.
You bet. We're going to take the next question now.
If you have a question and you're calling in telephonically, just press *6 to unmute your call.
Before I ask you the next question, I just want to make sure if there's anybody else who has a question. I don't want to hog. I do have a pressing question, so I'll give you some more.
Please ask your question.
Is it okay?
That's why we're here.
Okay, so this is again Dr. Agard. I'm with Hugs Therapy Services, and I'm wondering in terms of our mental health, what can we do? We've already organized some myself and some therapists. We are willing to give free services to our medical professionals who are on the front line, who are not getting a break, who is overworked and inundated with, especially Manhattan and New York, basically just not getting a break, not having a source of venting, a source of expression, a source of saying, I'm concerned for my own health. So we're giving that for free for our people who are serving on the front lines and their supporting staff. But in terms of the general population, we want to know if there's some funding that we can tap into, because we are going to be providing telehealth services to anyone that needs it. We have formed classes and programs so they can come in and form some normalcy. We have dress-up time because, as you know, when we're home, we fall into a pattern which is not healthy. We're not getting dressed. We're wearing the same clothes. Some are not showering. So we want to kind of get people back to normal to do some things. You know, we're going to do some activities. We're also going to share about what's going on, how you're feeling, how is this affecting you, what anxiety is this stirring up in you, this uncertainty, are you next? You know, all these fears and emotions that are coming out, as well as doing individual therapy one-on-one. We are providing that services. And this is a new REM, so we're paying extra for this technology that is HIPAA compliant. And we're asking our therapists to be a part of this and help, because we normally are able to embrace people. We're normally able to go out in the field and help. We cannot because of the physical distance. So we want to make sure people are not socially distancing. That is the key difference. Physical difference is we cannot be next to each other, but socially we must stay connected. And so we have formulated tools for people to be able to stay connected, to be able to vent. And in terms of services for our community, Hugs would like to know how we can tap into some of the funding, because we're doing the work and people are not working now and they cannot afford to pay. They cannot afford to do a lot. But we don't want to have that as a barrier to care.
Thank you for those great questions. You know, there's no doubt that every American is suffering in one way or another, whether they have the COVID virus or whether they suffer job loss or are stuck at home as a student or as a parent or a senior, or others like our veterans, while our first responders and others still have to go out to work in this dangerous environment, and that's going to have a mental health toll. I can tell you, one, we expanded telehealth for Medicare. I know it in phase 2, it applied to coronavirus procedures, but I believe there's been a further extension in phase 3. And Leah, if you wouldn't mind writing down that question about expansion of telehealth in phase 3 so we can get you a more succinct answer. And there may also be grants through CDC, HHS, or others for mental health. I know we funded over $130 billion to our health system to help with a whole range of issues, including mental health. So we'd love to be able to work with you to apply for any grants you may be eligible for. And of course, if you're experiencing a loss of revenue or need assistance with your payroll, I urge you to apply. Even if you're able to stay in business, we could help you use this money to really shore up some of the additional costs you have. Your business would be eligible for up to 2.5 months of payroll paid by the federal government, provided you keep everybody employed. So that's another way directly right now that you can help get an influx to help with 2.5 months of your payroll, provided you, or if you have to let some people go, you'll still get credit for those you kept. But that can provide a well-needed infusion of funding to help you with this in the short run as we look to long-term grants. But we talked about this before with the expanded unemployment benefits and sick pay and family leave. During these chaotic times, these terrible crises like the Great Recession or World War II, or now with the coronavirus epidemic, it does give us some opportunities to finally get things that we've needed for years to get done. And one of them is an expansion of telehealth that we've needed for years. Another that hasn't happened yet, but we're working on it. There's an opportunity again now for our state to expand Medicaid to cover the nearly 1 million people who are either make too much money to be able to qualify for Medicaid or too little money to be able to afford Obamacare, afford the ACA federal exchanges here in Florida. So that will be an opportunity because a lot of states have used that Medicaid expansion funding, which is up to $5 billion a year for the first couple of years, to expand mental health benefits and to expand drug treatment and recovery. So that if we can use this opportunity during this terrible crisis to extend Medicaid, that'll not only cover these nearly 1 million people, like your average family of 4 in Florida's 9th congressional district who makes $30,000 to $40,000 in total income a year, they, unfortunately, make too much money for Medicaid, which is outrageous right now, and most of them can't afford to get on the Affordable Care Act exchange. And I will say, we have the biggest federal Obamacare exchange in the nation. There's nearly 2 million people who get their insurance through President Obama's landmark, one of his landmark achievements. And so if we could do that, and we may be able to start re-enrollment again, we may be able to reopen it for another couple of weeks to expand coverage. And of course, that covers some mental health services too. So there are some opportunities during this terrible time to expand out coverage for people. So please work with Leah and others on our staff to identify potential grants. And please contact your lender about the Paycheck Protection Program that may be able to help you with your payroll as you're taking in a lot of these new patients. And over the next couple of months, we will fight for ACA re-enrollment to open up quicker and for expansion of Medicaid to help with these mental health issues that are facing millions of Central Floridians. Thanks for that great question. And I'm happy to take other questions or comments as well. I know people may be still formulating them, but we're happy to be able to take the time to hear from you. And we'll take our next question, Leah.
Hi, Cynthia Downing.
Yes, hi. Thanks, Leah. Thank you, Congressman Soto, for taking this opportunity to share this important information. Again, my name is Cynthia Downing, president of the Haines City NAACP. And a question that I have received from quite a few people actually, for the restaurant and hotel industry, a lot of them were laid off because of COVID, but some of them were allowed to continue to work, but their hours were cut. So if a young man was working 40 hours and now he's only working 20 because they're only doing delivery, and the same thing at the hotels because they have less customers, so they're getting less hours. Would there be an opportunity for them to apply for unemployment or any of the other benefits?
The answer is yes. They will still qualify for the federal unemployment benefit we just passed with a cut in hours. And Ms. Cynthia, thank you for that great question and your leadership at NAACP. I'm going to go over some of the factors of the unemployment benefits at length again, just so because I know a lot of this it's a lot to take in. So for our new federal unemployment benefit, it's up to $600 per week for up to 4 months. It applies to folks who were employees who lost their jobs or employees who have a loss in hours. It also applies to independent contractors and any other folks who work in the gig economy. That includes, I know Leah had mentioned, we have several hairdressers, like my mother, who was a hairdresser as I was growing up, or barbers who are out of work, and this has been a frequent question, they would be eligible as independent contractors for unemployment on the federal level. Now all those groups other than former employees would not be eligible for the existing state benefit, unfortunately, which is $275 per week for up to 12 weeks. You're going to want to contact your state legislators and state senators to advocate for those changes. We also, I'd be remiss if I didn't mention it over and over and over again, the state unemployment website is a mess right now. And people are having their calls dropped, they're having their claims, the screen freeze or their claims messed up while they're going online. Not everybody, but a lot of people. We just gave them $26 million today to help get their act together. And again, it's a state system, so we'll keep pushing them, but keep reaching out to your state legislators and the governor and members of the cabinet, because we need this desperately fixed for Floridians. But yes, those young men and women and others in general, regardless of age in the restaurant and tourism industry who had a cut in hours, they would qualify for some level of unemployment based upon their cut in hours to up to $600 under the federal benefit we just passed under the CARES Act. And I appreciate that great question.
Thank you. Next, if you would be so kind as to press *6 to unmute yourself. And those of you who are calling telephonically, if you all could please just identify yourself so we'll know who you are. Thank you. Any more questions?
I see on Zoom, Pastor Dollison. If you wouldn't mind, Pastor, tell me a little bit about some of the experiences your church parishioners have been experiencing right now. It'd be great to hear some of the stories that you're hearing for our information, if you don't mind.
Good afternoon, Congressman. Can you hear me?
Yes, I can hear you just fine.
Yes, I want to express also my gratitude and thanks for reaching out, and to Ms. West as well. She has been a great supporter, and I really appreciate her efforts and all that you're doing to keep us informed. You're right, it is a great impact on our churches. I think one of the callers just mentioned about mental health, and churches provide a great relief in many cases for many people just dealing with challenges of life itself. And without the church being open and available, it's been very challenging. However, there have been many who have met many other challenges with trying to provide streaming, which is kind of an interesting aspect too, but I think we're working through that. But now with the stay at home, that puts some challenges there. I think the governor, one explanation, I guess, probably a little bit about the executive order that he had signed concerning stay at home finally, and relating to churches. And I guess there's some ambiguity about that. I guess if there were gathering, I guess it was less than 10 people, or did you have any clarification on that at all? Because I think some churches were concerned about it. We do have some churches, I think, that are not altogether in compliance. Hopefully they will be, because they're taking great risk to gather as they normally would, and not being able to keep those safe distances from each other as well.
I'm looking that up right now, Pastor. I know that it was just came out 2 orders over the last 2 days. Yeah, we're gonna get you that exact information over the today. Leah will get that information, but I know that there's been some leeway given to churches, but we want to get you a crystal clear response on that one, since that order just came out yesterday on the state level. I'm not as familiar as the federal stuff, but we will get you that answer today. In the meantime, I also encourage you, since churches are eligible for the Paycheck Protection Program, to reach out to your lender to apply, because I know you all are hurting right now And this is a way for you to be able to get an infusion of your entire payroll for the next 2.5 months, knowing that there's less money coming in the form of donations because so many people are hurting right now. And that can help you leverage to take care of other missions you're working on. I know that you all are very involved in everything from spiritual healing to providing information to the community, to helping with people who need food, to any number of different works for our young people and our seniors. So we strongly encourage you all to reach out, and pastors throughout the district to reach out to your lenders, because you qualify as well. And this is a way to help us, all of us collectively, get through this crisis and allow you all to continue your missions, albeit in a different way. And by the way, we could use all the prayers we could get. So whatever you all can do spiritually to pray for Leah and I and the rest of our team, we all could use faith every day. But I think a lot more people are realizing how important it is in these times where we're all challenged to get through this together. But please, I encourage you to apply for that program, and then we will get you the exact order language today. We'll send it out to all the pastors who either participate in the call or would like that information.
Congressman, there's one other question I have.
Please.
I think it's critical because during this time, of course, we have the unfortunate task of, dealing with family or members who pass away. And, what are the guidelines as relates to funerals and that kind of thing, or if there's even the ability to have a funeral? We found at Bushnell, I think we had one pass away. I think only the undertaker could even go to Bushnell. So the family was not even able to go to the gravesite. And I know it's a very sensitive situation. Sure. And very difficult for families. So I don't know if there's been anything that has gone out that would give better guidance, because churches, that's kind of what we do, trying to help our people at their most vulnerable time. And certainly when someone passes away, and we have people that are critical, of course, as well. And we've been praying, for the families. And but we do know, and I just got a call today from my family. One of our members shared with me that her uncle passed away. I have a family member in Indiana who has COVID, who's right now quarantined. So all of our families is hitting close to home, and I think many of us are realizing this now. But that piece is very sensitive, and how do we deal or dispense with, our last responsibilities to persons who are deceased, and sadly, some of them could die from this virus.
Many of these lost loved ones, their bodies are unfortunately going to be isolated for at least some period of time. The health departments make those final calls, and then, of course, there's a ban on large gatherings. So we look to you all to help guide us in how you think we can honor the memories of some of these fallen loved ones while still making sure that we save lives in the meantime. There are no easy answers to this one. I have a call today with the executive director, the new one of the Orlando VA hospital, because he just got a shipment of dozens of metal sealed caskets for the Orlando VA, and it made the news. And of course, so I saw that yesterday. I have a meeting with him today just to get an idea of it. This is one of the tragic parts among so many others, because we do have a duty for those seniors who are healthy right now and those with pre-existing conditions who are healthy right now. And make no mistake about it, we could have healthy young people who still have passed from this coronavirus epidemic. So part of this, is God's answer and our spiritual leadership from our spiritual leaders like you on how we could best console people during this time. I know government plays our role, and it's unfortunate that we have to isolate some of these bodies to save others. And really our healthcare professionals will make those ultimate decisions. But this is one of the many areas where our faith leaders, you all know best on how to heal spirits, heal people's faith during these impossible times. But yes, in many instances, we won't be able to have formal funerals. and bodies will be isolated to protect those who are healthy and others from it. So this is areas where we need your help as a spiritual leader in the district to fill in the gap and figure out ways we can address those spiritual needs and memorialize these family members who have gone to heaven, but we still miss them. And so we're going to need your continued leadership on those things because unfortunately the answers right now are not positive ones for the individual family, but obviously in the interest of public health.
Yeah, I think that one of the things that it may be a consideration is that if loved ones do pass and we're not able to have a proper funeral or the normal type of funeral, with loved ones, and if there's even a funeral at all per se, and in the traditional sense, that we would probably look at a later date when this has passed, or we have an opportunity to do a memorial of some sort, and maybe be the only relief that we see available to us at this point. But yet stand ready, by other means to try and communicate with those families. And as I shared just before I came on here with one of the members about her uncle and her mother who lives in Orlando, and her younger brother is the mother's younger brother too, my age, and that so I was like, wow. So you realize just how serious this matter is, and I hope and pray that many more. And I want to say to our young people too, God, please take it serious, because this is the most serious thing I've ever seen in my lifetime. And so we approach it with that, and then following whatever guidelines necessary. Do you have anything to add that you think may be more helpful or be helpful? Because we get mixed messages sometimes from the White House in terms of, I do listen to those who actually make sense in terms of the scientists and what they're saying. So maybe just following their guidelines would be the best. Because about masking, if we go out or anything of that nature, have you anything to share with regard to that?
Sure. First, in God we trust first. And after that, Dr. Fauci, our CDC director, has been on point since the beginning. So I've tried not to, even as a public servant myself, listen to the politicians, but rather to our healthcare professionals. So Dr. Fauci, our head pandemic specialist with the CDC, has done daily briefings. He's been on point for weeks now. And so in addition to our faith, the good doctor is probably the soundest advice that we can get. And I will say this too, we're going to get you the specific guidelines for meetings for our churches, and we're also going to get you the specific guidelines for funerals after this call today for you to share with all our pastors. And I commit today to participating in your idea of having a vigil or mass memorial for those we lost, as we're allowed to aggregate in groups again in Polk County. I think that's a fantastic idea, and one that we could do a candle vigil to remember all those that we lost. In addition to the individual family grief, those who want to, we can show a community's worth of compassion, grief, and common respect for fellow members of our community. So I commit to participating in that. Should you all want to put something together with our pastors and the NAACP and others, I think that would be we could use community healing after this is done with.
Indeed. Thank you so much.
Congressman Soto, this is Dolores McMillan. Can you hear me?
Yes. Thank you, Dolores, for your leadership in NAACP here in Osceola County. And I could hear you.
Yes, and I'd like to thank you for this opportunity to speak to you on behalf of the citizens here in Osceola County. And I'd like to thank Dr. Agard and Dr. Johnson for their representation in asking questions relevant to the concerns of our citizens. And I want to shift the conversation a little bit toward, this is election time, coming up in August, the primary, and then, of course, November. What can we expect to hear from our state congressman in regards to the election season this time? Our candidates haven't had the opportunity to get out and canvass like they would normally do. So what can we expect to hear from the congressman to ensure that voting will take place this year? Because it's very necessary that we do exercise our right to vote. And I also want to take this opportunity to thank the courts for supporting our felons as far as giving them the opportunity to exercise their right to vote in August. So can you address those concerns, please?
Absolutely, Ms. McMillan, and thank you so much for bringing up those great issues. I'll take them in order of chronology. So the qualifying is coming up in April for congressional races, and then in early June for state and local races that will be on the primary in August and the general election in November. I support a reduction in petitions and fees prorated at the amount of time we lost since February to early March, and even more so if that's what we need. There's going to be there's debate over whether the governor can do that or not without a law change. So we may need a special session. So feel free to join me in encouraging our state legislators to get into a special session sooner rather than later. We just gave them $8 billion plus an additional $26 million for the unemployment website today, and they're going to need to allocate that. So we'll need a special session very soon, and that needs to be part of it, since whether it's federal or state, the actual qualifying dates, petitions, and filing fees are governed by state law, whether it's federal, state, or local. So I certainly support reductions in fees and petitions, given the difficulty and danger of trying to collect petitions right now, and the fact that right now is not a time to be asking for campaign contributions. And we're not going to go too far into that because that gets to the political realm. The second issue, voting. One, we should have statewide vote by mail for every Florida citizen who's registered to vote. Let's start with that as the baseline. Then we'll see where we're at in August and then again November with regard to what our healthcare professionals say about having early vote and vote on election day. But I do think we've had votes during World War II. We had votes during the Great Recession, and we've even had votes during the last pandemic in 1918 in this nation. So we may or may not have to look at flexibility with early voting, but we have to have these election day votes, even if there are issues, because there's so much at stake. But I think we backstop it with having vote by mail sent with postage paid by the state to every Florida registered voter, so that they can make their voice heard without having get out there. Then we may have to be careful in early voting, but we definitely have to have election day voting no matter what, because we've never skipped an election in this nation. So I have a real concern about not having an election day vote, but having obviously precautions about social distancing and having personal protection equipment and things like that. The last thing, thanks for bringing that up, Ms. McMillan, about our great victory again in the federal courts, knocking out this requirement for returning citizens to have to pay fees and fines if they don't have the ability to pay. Not only did the federal judge in Tallahassee strike it down, but then a 3-judge panel in the 11th Circuit in Atlanta struck it down. And then they went to what they call an en banc, which is all the judges, and they upheld it and struck it down. And so now there's an injunction. And so one thing that we really should do is continue to push our local clerks, including Armando Ramirez and others throughout the district, like Butterfield and others, to be able to have these large dockets where people can come in and show they can't pay, and then the judge can actually retroactively eliminate the fines and fees, and then there's no issue with the ability to get registered to vote. Tiffany Moore Russell, I was remiss in mentioning our Orange County clerk too. They're doing that in Hillsborough, in Miami, in Broward, and Palm Beach. So we want our clerks of court to work with our chief judges to have these dockets, because otherwise it's still wishy-washy about different supervisors allowing people to register or not, and whether they're going to count. But in the meantime, my other advice is tell all returning citizens to register to vote, regardless of this situation right now, and let the courts figure it out. What we don't want to have happen is returning citizens miss the voting deadlines, and you could still register to vote for the August primary, and of course we have plenty of time for the November election. So please tell all of our returning citizens, register to vote, and let's encourage our clerks to come up with these speed dockets we have already in Hillsborough, Palm Beach, Broward, and Miami, where they have 100 people at a time come in and get their fines and fees waived, as long as they're able to fill out an affidavit showing they can't afford to pay them. And that's consistent with what the federal courts have been saying. We don't need to return to poll taxes in dark days in this state's history, where we discriminated against minorities and other folks who were poor or didn't own land, or women, or any other excuses that they used to discriminate against people voting in the state. So thank you for those great questions, Ms. McMillan, and thanks again for your leadership with the NAACP.
Congressman Soto, we'll take one more question, and that question is from Dr. Charles Anderson.
Pastor Anderson, thanks for being on the line. Pastor Anderson?
Okay, I think I unmuted myself. I'm here.
I see you.
Hi, how are you? Good to have you.
Doing okay, considering we're all through faith and good works and hard work trying to help our community.
Well, thank you for holding this conference call with us, this Zoom meeting with us. And Leah, thank you for your support. And I want to thank all the pastors and everyone for being on as well. We appreciate your continued support of our local community. I know Pastor Dollison recently asked about the question from the Florida perspective. I was on a faith-based call with the governor's office this morning, and they addressed the issue of they've actually called churches as an essential workplace and an essential part of a place where people can meet. But the governor did, along with the Surgeon General, ask us to follow those guidelines of social distancing. And he also covered that as well with funerals, the Surgeon General did. And some of the things that he said that folks are doing for funerals is having a graveside service at the gravesite, but following the social distancing guidelines. But he did encourage us to do that. He did say that Florida is a place where he believes that religion and is protected by the Constitution. And he believes that it's important for us to continue to meet as churches, but wanted us to use wisdom as we met as churches and asked the clergy to work together to make that happen. That's what his response was this morning when he asked specifically about that.
Thanks for that guidance, Dr. Anderson, and that's very helpful. We know all our communities, including our faith-based leaders, are having to adapt to this terrible reality that we face, at least for the moment. And I appreciate that additional guidance, and we'll get the specific language and the orders to all of our pastors on the call, and feel free and we'll extend to all of our email list of pastors throughout the district. But that's helpful guidance. None of this is easy, and it will also it's forcing a lot of us to have to get creative with technology. But as many believe already, like I do, the Lord gives us resources to handle these things. And this technology like Zoom, where we're talking today, albeit from my office or from your bedrooms or churches, is giving us the means to at least try to handle some of these issues. What are some of the things that your parishioners are saying or feeling right now, Dr. Anderson? It'd be great to hear some testimonials.
I think for me, and like Pastor Dawson, a lot of our members, they're concerned about, of course, about employment. We have some of our folks that, of course, working at Disney, which Disney recently made a huge announcement about furloughing a lot of their folks in their organization as well. And so the sustainability of income has been something big, and it's great that we're having the ability to have folks be able to apply for that help with their finances through the unemployment process. That's one of their biggest concern. I think there's a lot of mental issues that people are dealing with. People calling the church and basically having a lot of anxiety about being home alone and being afraid. And so I'm sure, like the other pastors on this line, they've spent a lot of time just counseling people over the phone and praying with folks and using conference call lines to have prayer chains and so forth. That's been the biggest issue with the folks here, is making sure that they can meet their budget, pay their rent once this is over, and hopefully that the economy will jump back as quickly as possible once this ends.
Well, thanks for that. And we know with the new federal unemployment benefit for even a partial job loss, not a full job loss, the small business paycheck protection programs, the increased funding for food assistance, and the ban temporarily on foreclosures and evictions. Excuse me. Thank you. Should be a help, even though there's no doubt our community is hurting. And I want to close just by saying, we know that while government can be a big help, and we've seen some major new opportunities to help people during this trying time have been forged in the midst of this terrible crisis. And our healthcare responders do so much on the front lines to help out with those who are either sick or families grieving. There's no doubt that our religious leaders and our civil rights leaders, many times folks who are filling both those hats, also play a huge role during this crisis, which is why we wanted to make sure we can get you all the up-to-date information and hear what you all are facing and your parishioners are facing and your members of the NAACP are facing, because we know that it's going to take leaders throughout our community, including our civil rights, religious, and medical leaders, to help get us through this. But as Leah and I have mentioned over and over as we're trying to grapple with this, this too shall pass. And I believe together we will be able to get through it. And so I want to thank everybody for being on the call. This is just a continuation of a continued conversation. We will get you the summary sheets that right after this call, and Leah will work with Nicole McLaren and others in my office to get you the specific language on church services and groups gathering, on funeral services, and also on the eviction and foreclosure moratorium language, because I think that's going to come up a lot. We'll just get you the summaries on those as well, just to help you as things combine. Of course, we commit to doing another one of these over the next week or two to keep you informed and hear from you during these trying times. So please look out for those notices. Thank you all. And just, we could use all the prayers we could get to help both your parishioners, our constituents, with our nation to get through this. Everybody have a blessed day. God bless you, and God bless our district, and be safe and healthy, and we will speak soon. Thank you.
Lil, I'll also send you a copy of the, they're going to be sending out the transcript of that meeting with the governor, and I'll be sending that. I'll send that to you by email once I get it, so that your office can kind of decide how they want to disseminate that information as well. And just let folks know, this Wednesday, the 8th of April, we've been cleared to also have our mobile food pantry where people can simply just drive through in their car, pop their trunk up. We're going to drop a bag of food in. So we should have enough food to feed between 300 and 500 families. And so during this time, people really need some help with their food. And so spread the word, and we'll be, of course, practicing social distancing with masks and gloves and so forth. But we want to let people know that we'll be doing that on April 8th, 2795 North 10th Street, Haines City.
Okay, thank you. Thank you for that, Dr.
Thank you, Dr. Anderson, and thanks to all our civil rights and religious leaders and medical leaders being on the phone. We appreciate you greatly, and we look forward to continuing to have this dialogue during this trying time. Please stay safe and bless you all.